Hi, my name is Rebecca Binder and I will be doing my presentation on acids and bases and how it relates to my major, which is nursing. The history of acids and bases. Romans classified acids and bases by taste. They referred to sour substances such as lemon juice as acid or acidic, derived from the Latin word sour tasting. Robert Boyle expanded on Arnoldus de Villanova studies and found that certain plant-derived substances changed color in the presence of acids and bases. More history. The Swedish chemist Svante Arrhenius won a Nobel Prize in 1903 for his work. He proposed that acids and bases gained their properties because of the action of ions in the solution. Later on, Arrhenius said acids are simple substances that add hydrogen cations to water. He stated that the reason that acids and bases cancel out is because the hydrogen ions and the hydroxide ions react to form water, leaving salts behind. Terms you need to understand. Acid. Acid is a substance that releases hydrogen ions in the water. Bases. It is a substance that accepts hydrogen ions in water. Buffers. A buffer is a set of chemicals that can keep the pH of a solution stable by alternately donating and accepting ions that contribute to pH. pH. Measure of the number of hydrogen ions in a fluid. In the pH scale. This picture shows a picture of the pH scale. It is the measure of hydrogen ion concentration. This picture gives an example of basic, which is at the bottom, acidic, which is near the top, and then water is neutral. Each different color block is a step farther from neutral. The more acidic a solution is, the more hydrogen ions it has. Acids. An example of acid is vinegar, oranges, lemons, wine, and battery acid. Each of these three pictures give examples of acids. The higher the number of hydrogen ions, the lower the pH. Acids give up hydrogen ions in water. Acids can lower the pH of a solution, and strong acids ionize completely in water. Bases. An example of base is ammonia, sodium bicarbonate, baking soda, and toothpaste. Each three pictures seen here is an example of a base, such as Crest toothpaste, baking soda, and sodium bicarbonate. Bases accept hydrogen ions in water. They can raise the pH in a solution and make it more basic or alkaline. All about buffers. Buffers are used to balance the pH of a solution. A buffer is a mix of a weak acid and its conjugate base, or a weak base and its conjugate acid. These pictures show an example of a buffer and buffered solution. How it relates to nursing. The pH of blood is slightly alkaline and has a normal range of 7.35 to 7.45. This pH allows for normal enzyme and cell function and normal metabolism. If the blood is slightly acidic, cardiac contractions diminish. If the blood is alkaline, basic, neuromuscular functions become impaired. How it relates to nursing. Just below 7.3 could put the patient in a coma. If the blood's pH were to reach 6.8 or 7.8, the effects could be fatal. A nurse has to be vigilant about the patient's conditions, which includes the pH of the blood. How nurses treat acid-base imbalances. Nurses treat metabolic acidosis by correcting the underlying problem. For diabetic patients, they control blood and glucose levels. For poisoning, they focus on removing the toxin from the blood. In the case of sepsis, nurses could use antibiotic therapy, fluid administrations, and surgery. For respiratory alkalosis, the treatment usually would be to encourage the patient to slow his or her breathing. Often, breathing into a paper bag will help because it will allow a patient to rebreathe CO2, raising the CO2 in the blood. An example in the field. Steve Barr, 38, has type 1 diabetes. He hasn't been feeling well for the last 3 days and hasn't eaten or injected his insulin. He's confused and lethargic. His respiratory rate is 32 breaths per minute, and his breath has a fruity odor. His serum glucose level is 622 milligrams while receiving 40% O2. His ABG values are as seen here. The nurse will conclude these ABG values reveal metabolic acidosis with partial respiratory compensation. The patient's pH and HCO3 indicate acidosis. His PaCO2 is lower than normal, reflecting the lungs' attempt to compensate. Because pH is abnormal, you know compensation isn't complete. These are my cited sources. Thank you.